terms of the technology we've chosen to use, we've come up with an application called Linda. Linda is a mobile-based application, and this application utilizes the Bluetooth technology. It does a couple of things. One is that using the data that is available from government, the people who've either tested COVID-19 positive or people who've been tested and released, their numbers identified, such that if your Bluetooth is on and theirs is on, and we are encouraging the public to make sure that their Bluetooth is on wherever they are out. So anytime this person gets close to you, your Bluetooth vibrates, and that is supposed to warn you to keep distance. And that is part of our efforts in social distancing, but also to encourage people to stay at home. So that's the first part. The second part, we acknowledge that there have been issues of tracking, either people who've been in contact with COVID-19 positive cases. And one of the easiest ways to do that using this technology, because of that Bluetooth technology, then it becomes much easier for us to be able to see who was in contact with who. But we're also running a challenge on the app to try and encourage people to stay at home. And this is, the challenges have been built around, normal mundane things that we are being encouraged to do. We are being encouraged to stay at home and wash hands. We will build challenges around that, such that if you stay home for 7 days, you qualify for certain rewards, such as data bundles, especially for the younger generation of Kenyans. But we are also building into this app rewards such as shopping vouchers, so that people can access food and shopping for their basic needs. And then, of course, the same with this app provides for a self-assessment. I need to emphasize that this is not a medical. It's not a medical app. The self-assessment is based on the guidelines that have already been given by WHO. So this assessment is able to show you, what are the things you should be looking out for. And of course, there's a back end to this app. And based on the kind of information that is being collected, it becomes easier then to encourage, or rather for the medical personnel to reach out to those cases that we think are in the danger zone. And finally, we are using this app to make sure that there's an update of information going out, because one of the challenges we've seen in trying to fight COVID-19 is there's too much misinformation going on.